let's talk about the spread of the virus itself, because of course we have been seeing some alarming numbers and alarming rises over the past couple of weeks. What effect are we going to see potentially from the July 4th weekend, where we're seeing a lot of pictures of people gathering for cookouts and other sort of holiday activities? Dr. Peter Chin-Hong is joining us now. He is University of California, San Francisco infectious disease specialist. He's joining us from San Francisco. Dr. Chin-Hong, thank you for being here. We are seeing cases go up in California, in particular in places like Marin County, just north of San Francisco. What do you think has changed here? What do you think that sort of people are getting wrong that they need to fix to try to slow the tide here?
Thanks for having me on, Julie. Well, I think it's a complex question because there's a heterogeneity of how California is reopened in general. So I think it became confusing from county to county. LA did one thing, San Francisco did another thing. In the beginning, we were all unified. It was like we're all in, everybody was on lockdown. It was pretty easy to understand. And now your bars are closed, so maybe you go to the next county. I think the big effect started probably around Memorial Day, and we call it the Memorial Day effect, when people just got tired. It was lockdown fatigue, and people didn't really know anyone who was that ill. That was part of the California miracle. It wasn't like the tri-state area where everyone knew someone who was in the hospital. In California, we were probably victims of our own success because, again, you didn't have that negative example to aspire to. So I think people got fatigued. They sort of went out. There was an increased polarization between public health messaging and the public. And there were death threats, actually, to some public health officials who were advocating wearing masks around Memorial Day. And then that sort of led on to graduation. And then as we began to see that there wasn't only the people going to the beach in Huntington or Newport Beach, it was also what was happening behind closed doors. So a lot of family gatherings.
Doctor, that's a key point, because we've seen beaches close not only on the West Coast, but Florida, for instance, closing beaches. But is that an overreaction? Because if you go to the beach, you're outdoors, and we're seeing the WHO letter about indoor air. And if you go to the beach, but then go to a bar, that's one thing. But if it's just the beach, why close the beaches if we keep the bars where the people were congregating at the beach closed?
Yeah, so that's a great question, Adam. It's not really about the beach per se. It's just how many mouths and noses are together. People certainly can go to the beach, but if they can be spaced apart, sure, I agree with you. Outdoors is definitely much better than indoors. But it's the activities and the duration of time that people are on the beach and the packed aspect that's more concerning than the beach itself. So if there was a way, like the park rangers in California have come up with a way of sort of like decompressing when they're able to open again. Of course, now they're somewhat on lockdown, depending on which county you're in. But it's all about how many mouths and noses are close together. Of course, if they're indoors in a bar, it's much worse than outdoors. But I would say, it's also the duration of time that you're next to someone as well.
Hey, Dr. Chin-Hong, Rick Newman here. Can you tell us what we know at this point about transmission of the virus that might be happening now from the younger people who are the ones at the bars and contracting it now at a higher rate among young people than they did earlier, and whether they are actually transmitting it to older people who might be more vulnerable to the virus? Is that actually happening?
That's a great question, Rick. I think that will be a lagged effect. So I think right now we're seeing, the younger folks getting infected and also actually coming into the hospitals and the ICU. So younger folks are not immune from getting sick. They may not die, but that doesn't mean they wouldn't get sick and be in the ICU for a very long time. And, we're also learning that post-COVID, there's also this chronic fatigue, sort of like chronic symptoms that some people get. So it's not a walk in the park, even for a young person. But in terms of the effects on the older population, I think it will be lagged. Probably, again, they have to go home, transmit it to someone in the household, and those people have to incubate and then come into the hospital. So, if we see something, it will be, probably 2 weeks after this young epidemiology. Of course, it started on Memorial Day. We're also seeing older folks. And of course, there's a big San Quentin prison outbreak too, where it's kind of traditional COVID. But in the general public, I would still agree it's younger for right now, but they're still coming into the ICUs.
Doctor, I'm wondering what you view as being the risk factors associated with domestic travel. I mean, just looking at the holiday weekend, we saw airline passenger numbers in the US exceeding 700,000 for the first time since the pandemic began. Of course, with the holidays happening, people traveling between states, potentially coming from hotspots to other areas where there are fewer infections. And what sort of increases, if any, are you expecting to see as we have this increase now in airline travel?
So it depends on the airline and the duration of the flight. So some airlines sort of like defiantly announced that they weren't going to keep that middle seat open because they said, well, the front row and the back row are still close to you. So that sort of lack of decompression of a plane is concerning to me. The other aspect is whether or not people are actually enforcing mask wearing on board. Of course, we've seen lots of social media pictures of people yanked from planes and stuff. But I'm just wondering sort of day-to-day experience of those people. But I think if people wear masks on a plane, it does give you a substantial protection. You know, we've had, there was an example of a famous case of a patient who flew from China to Toronto, and he wore a mask and he didn't know he had COVID at the time. Later found to have COVID, and nobody in the surrounding areas got COVID. So the masks are protective in that sense. So if people do go along with those, it is still risky if you go on a long flight, you know, for hours to Europe or Asia. Europe, of course, wouldn't take us right now, but it is riskier. But in general, people can do a lot of things to decrease your risk.
Wearing a mask is one of those things. Thank you so much, Dr. Chin Hung. Peter Chin Hung, UCSF. He is an infectious disease specialist there. Appreciate it.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.